Adults Health and Active Lifestyle Scrutiny Board meeting. I'm Andrew Scopes, I'm a councillor for Beeston Holbeck Ward and I'm the chair of this board. You're very welcome to today's meeting. Just to let everyone know that this meeting is being recorded and webcast both live on YouTube and you can watch it back afterwards as well if you're super keen. For the benefit of people watching online, we're going to start by doing some introductions. What I'll do is I'll start with just board members, so we'll go down to Councillor Gibson and then we'll come back up this side and then we'll introduce the other people who are here for the meeting shortly after that. So I'll start to my left, please. Thank you.
Good afternoon and a Happy New Year. That's the last time I'm going to say that this year. I'm Councillor Kevin Ritchie, Bramley and Stanley Ward.
Good afternoon, Happy New Year. Councillor Bromley for Horsforth and Rawdon.
Good afternoon, everybody. I'm going to say bar humbug. And for a change, I'm Ray Jones. I'm from Horsforth and I'm substituting today.
Good afternoon, everyone. My name is Councillor Taylor and I represent Chapel Allerton Ward.
Good afternoon, I'm Councillor Holroyd and I'm Ardsley and Robin Hood Ward.
Good afternoon, Councillor James Gibson, Crossgates and Wimbledon Ward.
Good afternoon, I'm Jonathan Phillips. I'm co-chair of Health Watch Leeds and I'm a co-opted member.
Councillor David Blackburn, Farnley and Wortley Ward.
Good afternoon, everyone. I'm Sandy, Councillor Lay for Otley and Yeadon Ward.
Good afternoon, I'm Councillor Lynn Buckley from Allwoodley Ward.
Good afternoon, everybody. I'm Councillor Caroline Anderson from Adel and Wharfdale Ward.
Good afternoon, I'm Angela Brogden, the Principal Scrutiny Advisor for this board.
Super, thank you very much and welcome everyone. Let's start by going through the first few items as usual, so I'll pass over to Angela to run through those for us. Thank you.
Thank you, Chair. In relation to item 1, just to confirm there are no appeals against the refusal of inspection of documents. Under item 2 there are no items for exclusion of the public. In relation to item 3 there are no late items, and under item 4 at this point please may I ask if members have any declarations of interest to declare in accordance with the Council's Code of Conduct. And I shall take silence as none, thank you. And in relation to item 5, we do have apologies from Councillor France May and Councillor Jones attending as substitute member. Thank you.
Thank you very much, Angela. Okay, so let's move on to the minutes of the last meeting. Firstly, do any members have any points of accuracy they want to raise? Okay, thank you. I'll take those as a true record. Matters arising. Angela, have you got anything to raise? Nothing from Angela. Anything from members in terms of matters arising? I can't see anyone indicating, so we will move on there. Okay, so we're going to move on to the first substantive item of today's meeting, which is the Leeds Safeguarding Adults Report, Progress Report. But we're going to just start with introductions of the other people around the table. So I'll start up to my left with Councillor Flint and we'll go around with the introductions of other people at the table. Thank you.
Afternoon, everyone. I'm Emma Flynn, Councillor in Wheatwood and Exec Member for Equality, Health and Wellbeing.
Hi, I'm Tim Fielding, Deputy Director of Public Health and deputising for Victoria Eaton today.
Hi, I'm Jane Wallen. I'm Chief Officer for Active Leeds Operations and Culture in City Development.
Hi, I'm Rob Wood and I'm Head of Intelligence and Performance for Adults and Health.
Good afternoon, I'm Shona McFarlane. I'm Deputy Director for Adults and Health.
Good afternoon, everybody. I'm Caroline Barrier. I'm the Director for Adults and Health.
Good afternoon, my name's Richard Jones. I'm the Independent Chair of Leeds Safeguarding Adults Board.
Thank you very much. Just on a non-board related item, I understand that this is Shona's last meeting on the board. Is that correct, Shona? I'd just like to extend my gratitude to your service to the board over the years and wish you all the best. When you're not here, I'm sure you'll have a great time. Okay, so let's get on with this report. It's very important. So we're going to start with Richard. I assume you want to say some introductory remarks, and then we'll and Caroline's welcome to make some comments, and then we'll go to questions, please. Thank you. But you can assume we've read the paper.
Yep. Okay, thanks, Councillor Scopes, and thank you for the opportunity again to provide you with an update on where the Adult Safeguarding Board is at in terms of its priorities and some of its challenges. We work with 4 key priorities. We want to be citizen-led, we want to raise awareness and understanding in our communities, we want to develop citywide approaches increasingly in conjunction with Safer Leeds and our colleagues in Children's Services, and we want to absolutely drive through learning and improvement to ensure that we can be confident about ensuring that we're improving things for very vulnerable citizens that sit out in the wards you represent. So just quickly, in the reports before you, you'll see updates on the work we're doing around domestic abuse. We're working with the 2 other boards in the city to think about how together we focus on shared action around domestic abuse, and part of the work we'll be doing is just reviewing how people with safeguarding issues experience domestic abuse procedures. We're doing a lot of work around self-neglect, and I've talked about that in the past with you. I think we're seeing some exciting opportunities develop around our work with ethnically diverse communities, and we are increasingly focusing on assurance, on the quality of what it is that happens in each of the partner agencies. And we focused last year, 24-25, on care settings. This year we're focusing on how it is we're delivering people's desired outcomes. At present, one of the statutory duties of a Safeguarding Adults Board is to undertake safeguarding adult reviews when somebody suffered significant harm as a result of neglect, or they've suffered harm, that they have care and support needs, and there's been a failure of working together. So we have 3 cases. We had none last year, but we have 3 already this year that meet that criteria, and we're in the process of undertaking those 3 reviews, 2 of whom involve issues around self-neglect, and one of which involves a younger, vulnerable woman who was then sexually assaulted in temporary accommodation. And as I say, we're not in a position yet to report on the learning, but so you're aware, as a committee, there are 3 safeguarding reviews underway at the moment. I just wanted to say something about the activity levels, and we'll come to that, I'm sure, with some questions. But what you'll see is that we've not seen an increase in safeguarding referrals across the city. That's not either a good or a bad thing, I don't think. What is a good thing is the level of conversion that those referrals are seeing now as they move into inquiries, safeguarding inquiries. And I think it's really positive. We're seeing an increase. It's a challenge for Caroline Shona and colleagues because that's a lot of work. But to see that increase probably suggests to me that people are increasingly making referrals that meet the criteria and then need some further action. So I think that's a good thing. I think the other 2 things I'd pick out is that when we look at whether or not we're delivering the outcomes people want, either fully or partially, Leeds is delivering top quartile performance nationally at 95% of cases. So that's a slight increase, a tick up. And in terms of risk being reduced or removed, that's up slightly too. And again, performing at national average. So the other thing I'd very quickly highlight is that when you look at one of the challenges we've got around awareness and understanding, and it is positive, but it's very small steps to see an increase in referrals from Black, Asian, Afro-Caribbean communities, although we still have got work to do there, and it's one of our priorities as we continue to move forward. And then finally, Councillor Scopes, just to say we've included a link to a case that has a story of somebody who was a minor who got into real issues following the loss of his wife. So you'll have seen a video there that just gives you, I think, a real in-depth understanding from the family's perspective of what it means to work with some of the challenges that families, neighbours, but particularly frontline staff are having to work with around issues of capacity. And I've also included 3 cases where last year we had referrals of concern but didn't meet the criteria, but to give you some assurance that even when we don't initiate a safeguarding adult review, we expect action to be taken and we follow that action up. And then finally, the context is a challenging one, both for families, communities, in terms of cost of living, mental health issues, but it's a challenging one structurally too at the moment. And I think some of the NHS changes are ones that we're keeping an eye on in terms of ensuring that safeguarding remains at the core of the new system and the new way of working. And I can give absolute assurance that that commitment exists now. And then the final comment I'd make, just to follow on yours, Chair, is just to say that partnerships are ultimately about people. And one of the people we're going to really miss is Shona. Shona's been a significant leader in the safeguarding system in Leeds. She's been a super leader. She's made significant commitment and contribution to ensuring that we continue to work on Leeds being a safe place for vulnerable adults, and I'd want to thank her as the chair for her contribution. And we look forward, obviously, to working with Linda McDonnell as she comes into post. I'll leave it there. Thank you.
Yes, please. Thank you very much. So just a few points from me, and reiterating some of what Richard has already stressed. I think it's very clear to see that we have got a very strong partnership approach on our safeguarding board, both in terms of our system partners coming together and being active and proactive on the board, but equally working across the other boards that we have in Leeds, the Children's Partnership and Safe for Leeds. Within the Adults and Health Directorate, from our own perspective, we've focused considerably over the last 18 to 24 months on improving our internal audit processes and really embedding a culture of practice learning amongst our staff in relation to the outcomes of safeguarding investigations, so that where errors do occur or where there is gap, we make sure that we're not repeating those difficulties, and we're learning and striving for continuous improvement. That was reflected in the CQC inspection report of earlier this year, where their findings were that we've got very robust processes in place for keeping people safe, and it's a very inclusive approach where people are at the centre of safeguarding matters. Finally, and just to really drill the point that Richard has made, we are seeing considerable increased complexity of need for people requiring adult social care services generally, but also that then translates into more complex safeguarding matters as well. We've really focused on self-neglect over the last few years, where people have capacity but make active choices where they don't want to engage with the offers of support, and we're doing quite a lot of work to unpick some of that, which is multi-layered, very complex and very time consuming for our integrated neighbourhood teams, but they really absolutely prioritise safeguarding work above anything else within our teams, which is absolutely the right thing to do and which I'm rightly proud of. Thank you.
Thank you very much. So members, if you want to ask a question, please indicate in the usual way. But as I can't see anyone, I'll start off. So I have 2 questions. So the first one is around is on page 3 of your report, page 23 of the pack, around domestic violence and abuse. I just wanted to understand a little bit on how whether you have whether there is a sort of a gendered approach to the strategy. I imagine people of different genders express and are experience domestic violence differently, whether that's male on male or whether it's female on male or male on female. And I think there's probably quite a nuanced discussion there. That's why I'm trying to be delicate with my words, but I think something that's really important, making sure we provide the right services to the different groups that experience domestic violence. And the second one is sort of linked to one of your other things around the real interest in self-neglect thing. And I just wanted to just have a little bit more understanding of your take between the challenge between liberty and the need to support people. And when I read your examples, which I appreciate you putting them in, I think it's a real challenge for us as an establishment, as it were, as the city, to know where the line is for intervening versus our personal liberties. We have a right to live in a situation that other people might not think is the best for us, and where you think that is. So those are my two questions. Thank you.
Thanks, Councillor Scope. So in relation to domestic abuse, we are working primarily in conjunction with Safer Leeds and colleagues there. So Safer Leeds leads work around domestic abuse, domestic violence in the city, and we work with them. When it comes to safeguarding adults, and what we're talking about there is people with care and support needs. They don't need to be receiving a service from the city, from Adults and Health, but they will have needs that might be related to mental health, or might be related to drug and alcohol, or previous trauma in their life. Then our job is to ensure and to be clear that their voice is being heard, and we are working effectively with them. And as you say, that will look differently for different people of different gender or sexual orientation. It will look different in relation to people's cultural and religious background too. Aside, though, what I would say is that the work that we are really focusing in on the moment, and it rises from a review, a domestic homicide review that was done in Southend of a young woman who died, who'd been living in Leeds with her partner prior to moving to Southend. The focus we've got at this moment in time and in the coming year is to walk through the pathway that exists, but seeing it particularly from the perspective of somebody with care and support needs, because sometimes processes work for most people but not all people. And I think one of the pieces of assurance that we haven't got at the moment is how well is it working for people who have care and support needs, and primarily we need to be responding to with a safeguarding hat on rather than and with a domestic abuse hat on too. So that's what I would say. I think the wider strategy around domestic abuse in Leeds is owned and developed and led by Safer Leeds and colleagues there. We work with them. That's the area we're wanting to look at, Councillor Scopes, with a particular focus on the people that we're here to support. And then in relation to self-neglect, absolutely. So this issue, so you'll have seen one of those cases that we looked at, and I referenced, involved an elderly gentleman who died following a fall in his own property. He had capacity, and this is one of the big issues and challenges that colleagues both in the statutory and the voluntary sector have to deal with. So somebody it can make poor decisions for themselves and do things that, generally speaking, others might think would be unwise or a poor decision. Doesn't prevent people working with individuals in that circumstance. And there was some great work with that individual who died. He was a householder. His house was in a dreadful state. There had been significant numbers of interventions of people trying to build a relationship and build confidence with him. And in a sense, that's what that video, if you had got the chance to see it, of the the daughter talking about her father, the ex-miner. That's what that kind of story flags, which is this was an individual who had capacity to make poor decisions, but ultimately it was the kind of engagement, I think, of some nursing staff that enabled him to start to move forward on a different track. So we've got to we have to work with the Mental Capacity Act. We have to work with the issue of mental capacity and consent, but equally we work with values and an approach around professional curiosity and a trauma-informed approach, because we know that for a lot of these individuals something has happened, and until you're able to engage the person with that particular bit of their life, you are always going to get the door slammed in your face or a no. So I think one of the things that we've learned as we've developed our work around self-neglect is that you can get lost with kind of legal issues, but what really matters is building relationships, professional curiosity, and trying to walk alongside people who've often had incredibly difficult and challenging circumstances to deal with. So I'll leave it there. I don't know if that helps with the question.
Thanks, Richard. I appreciate your response on both those items. Okay, Councillor Lay next.
Well, that's taken the wind out of my sails. I was going to talk about capacity to make poor decisions and professional curiosity. As most of the board knows, I've 37 years as a frontline nurse in emergency care. Things are significantly better than they are when I first started, but there is still work to be done, of course. When I first started out, we'd never have talked about having professional curiosity. Now it's drummed into us at every opportunity. Some of the things, it is incredibly difficult to know where the line is for capacity and the ability to make unwise decisions in an emergency department that's full to the rafters. It would be fair to say that sometimes when a patient who perhaps is going to make a decision that I wouldn't make decides to leave the department, when as a frontline worker you know that there's all this work going on in the background as well, it's really difficult to find the time to sit down with that patient and say, can I talk you through it? Particularly if I'm the triage nurse in the emergency department, I have a few minutes, and in that period of time I've got to come up with the decision making as to whether that patient goes straight through into the back of the department to be seen first or rapidly, because we always see the sickest quickest, or that's the intention, or whether we pop them back into the waiting room. So some of the stuff around liberty and much of what you've said, Richard, has answered my questions. So I'm going to ask a slightly different one, if that's okay, because this is all a high-level report. When I make my referral into the safeguarding teams, what happens? Because we often don't find out. So talk us through the process of receiving the response from a frontline nurse or whoever, member of staff, and what happens through that. Thank you.
Yeah, no, thanks, Councillor Lay, and it's really valuable to hear your experience, if you like, on the front line. For me, I'm going to hand to Shona because I don't manage your frontline services. But what I can say is that, and I know that Adults and Health are working hard on this, because Caroline was part of a conversation we had with 20-30 colleagues from a range of organisations earlier in 2025, when we were asking them what works and what doesn't work. And one of the things that people have said is, how do we ensure that we get responses to referrals? So we know it's a challenge for Adults and Health, and it's a challenge they're working on. But what happens in detail, I think I have to pass you to my colleagues to my right.
Thank you, Richard. A test for my last scrutiny meeting. what happens is safeguarding referrals are treated as the ultimate priority, as Richard mentioned earlier. The safeguarding referral comes in through the contact centre, it's logged, and it goes straight to one of our frontline teams who will look at the referral and will make a judgment as to whether it meets safeguarding or whether it's a request for service. Because quite often people think that something's a safeguarding issue, and it's not. It's not about harm, it's a request for service. We treat both of those with equal respect, but we respond quicker to the safeguarding inquiries. We would then check with the, this bit will depend on the situation, we'll then check with either the family, the person, the provider, the referrer. So we will try and have a conversation with the referrer at that point. If we can't get them, we will make a response to the individual. And we will then go out and see the individual, or we will speak to the provider and ask the provider to speak to the individual and carry out an inquiry. It's very person-centred. The board has a really good policy called Talk to Me, Hear My Voice, which is very, very person-centred around how we manage safeguarding. So we don't do, it isn't by number, it's in line with the individual's requirements. Once we've established where the harm has been caused and whether there was an individual that caused it, or what the situation is, we will do a number of things. One is we could do a risk management response, which is to help the person to manage the risk they're in. Or we could, in the most extreme circumstances, make them safe in some way, which might involve supporting them to move into residential care or provide them with staff support in the immediate sense, depending on the issue. And then we'll undertake the inquiry, which will establish what happened and what needs to happen next to make that person safe. Right the way throughout that, we will be talking to the individual. We then reach the end of that process, which is in line with the person's own wishes. It could ultimately be an outcomes meeting, which involves everybody. If it's a care home or a home care agency, we might have an outcomes meeting, which involves the family and the individual. We know there's an issue about not getting back to people. Some of that is about, for example, when the ambulance service refer to us, they work shifts, we can't get back to individuals. We can spend 2 or 3 days trying to find the right person to speak to. That's not a good use of our time, it's not a good use of their time. So we're working on a way to make a more automated response to safeguarding referrals, which ensures that you know that the referral has been received and something's been done about it. So that's an action for us in line with the improvement plan that we have in place. So that's the process. I'm happy to talk to anybody about it individually, and it really does depend on the situation for ultimately an accurate response on that one. Thank you.
Yeah, happy, Councillor Day? Yeah, great. Okay, Councillor Taylor, please.
Thank you, Richard, for the report. It's absolutely interested. But you've kind of answered mine, and so did Councillor Lay feed into mine. But I'm going back to the 70-year-old that was withdraw services and if ambulance. What I would like you to explain, when someone withdraw the services, do you follow it up? Do you look into it? Because sometimes 90% is close relative, is the abuser. And when you're in front of them, they are the best to look after them. So what happened when one withdraw and go over to B? What do you do from there?
So this is a feature that that will sit in one of the safeguard adult reviews I've discussed. So one of those cases involves somebody terminating services, and kind of every situation is different, and people are individuals. And in the case that I've referenced here, where there wasn't a failure of working together, what we saw was a family stepping in to take on caring responsibilities, which ultimately resulted in a lack of effective care and admission to hospital, significant pressure ulcers and neglect, and a death very quickly. So it goes back, I think, to questions about professional curiosity. I think it goes back to the issue that we've already discussed, as you probably suggest, around capacity to make decisions. And it goes back to, I think, staff talking to each other and actually being clear about, do we think this family's got the capacity to do the things that we're asking them to do? So having shown them, for instance, how to turn somebody in a bed, are we confident they can do that? And again, people can shut the door in your face, and that can be the response. But equally, if you can build a relationship, and that is challenging because it goes to Councillor Lay's position, but also to the challenges that Shona and her staff, Caroline and her colleagues are facing, colleagues in the NHS are facing, which is just time to build a bit of a trusting relationship. But in that case, what I think we felt could have happened, and it wasn't a failure of working together, were there opportunities just to follow up and see how well? Because the issue of capacity, somebody can make decisions, but unless they can execute the decision and they have executive capacity, then you're potentially on a slightly different position. And just a conversation between professionals can enable people to have a sense of, you know what, I feel that too. I've got a gut sense that they're not going to be able to manage. So how do we support them? How do we continue to see that things worked? Rather than, I don't want the service anymore, goodbye. So those were some of the issues that were that sat in that case, and they sit in one of the other cases that we'll be publishing once we've completed our review.
I think sometimes, sorry, Chair, body language tell a lot of stories. You don't have to open your mouth. So just say this lady was in your care for 10, 15 years, whatever, quite a while. You've been visiting. Body language says, because the relative who was going to take charge, have I seen this relative before, her action with the individual, is all those things looked at, are questioned. Sometimes it's hard for you to, because I'm the same background as Councillor Lay, to ask the question to this individual that you want to ask it. But body language is very important. You don't have to open your mouth.
Yeah, so the work that's been done, I think body language is important, but I think being trauma informed, so the work around understanding that people don't, what you see on the day, is a person, but it's a person with a history and a set of experiences, some of which they might have disclosed, some of which they weren't. So all of that requires colleagues, and the training that they get will ensure that they're thinking, as you say, about body language, how somebody's presenting. But it's that kind of curiosity, and often that curiosity is difficult to create unless you're in conversation with your manager, unless you're in conversation with a colleague, unless you're talking to the district nurse who's making those visits too. And it's just, that's where, in that particular case, we felt there was further awareness and development needed just around curiosity. And it's easy to say, I used to be a social worker many years ago. It's easy to say, difficult to do, but that's what we require of people, and that's what I think we expect of our frontline staff. And I think generally speaking, that's what people are doing, notwithstanding the challenges that they face.
Yeah, thank you, Councillor Taylor. Good line of question. Okay, I'm going to bring in Jonathan next.
Thank you, Chair. Just wanted to explore a slightly different area of the report, which is on page 5, citizen-led approaches, and you talk about that you're wanting to increase your approach to engage with various citizen groups.
Yeah.
And I wonder if you could say a bit more about that, the direction that you're taking.
Yeah.
Please.
Thank you, Jonathan. So we did a lot of work a few years back in terms of setting out what good looked like from a citizen's perspective, and that's really our talk to me, hear my voice approach. That's our model. What we've wanted to do is to build on that. So what we're doing at the moment is we are engaging with our partners, health partners, local authority, Avanet, probation police, to look at the current ways in which they're engaging with citizens. So there's I think it's the Fresh group that sits in adults and health, but there are other groups in health. There are other groups in some of those other networks. So rather than create a separate kind of set of approaches, Jonathan, we're asking for our partners to identify the groups that they're engaged with, and then to take into those forums questions and to build conversations around how confident are you and do you feel about raising a concern? What has your experience been of going through a safeguarding process, or what are other people telling you about that approach? And on the back of that, we're wanting to bring that together into an evidence base to give us steps forward in terms of, well, what do we need to do? Rather than assuming what it is that people might say, that's the way we're doing it. So rather than trying to set out a Leeds Safeguarding Adult Board engagement piece, we want to use existing engagement forums, and if Health Watch can help us in that regard, fantastic too.
Yes, I think Health Watch might be able to help, but also I think it's worth referencing that the Health and Wellbeing Board has commissioned a piece of work looking right the way across the system about how engagement is going on, and it seems quite important that the work that the Safeguarding Adults Board is doing is meshed into that as well.
Good, thank you. I'll take that as a comment. Yep, thank you. Thanks, Jonathan. Okay, Councillor Ritchie next.
Thank you, Chair. My question again was going to be around that challenge of engagement and people opting out of services, but I just want to continue on that theme with an ask, because in the report it talks about the proactive assurances sought from organisations and references the great work that's gone on. It does seem to be very professional reliance or professional curiosity. I just wondered if it's possible to sort of broaden the sort of potential witness contact to try and get through the door, because a badge can put people off, can't it? I realise there may be confidentialities around that, but often neighbours may have a better way in, for example. So I just wondered if that could be looked at. And just to give some feedback, I made a safeguarding referral over Christmas, and I was really pleased to hear that the police had already made that referral. So that gave me some assurance that the system's working. Very small case, one example, but I thought worth sharing with you.
No, that's good to hear. I think in terms of, as you say, assurance, I think it is fair to say that we use a range of approaches that seek agency. So we have to seek agency assurance to a large degree. I think the challenge is, how do you get to the real experience of people who either have been through the process, and again, I'll just flag that video that's linked into the report, because there you'll hear a story. But how do you get that experience, and how do you get that experience, as you say, from families or friends or neighbours? The way we're kind of progressing that in Leeds is that we are using, the networks that exist, and third sector networks in particular. So I talked about a listening event we had last year. This year, I'm just in the process. We're engaging a set of conversations with about 30 agencies across the city, where I'll be talking to people. Colleagues in the business unit will be talking to people about what is it that you're seeing and hearing from people, And then we are running a huge event in June, which would involve 80 odd hopefully 80 plus agencies talking to us about this is what we are hearing from the people that we represent, and that's a huge kind of sector that represents communities of interest, ethnic communities, religious communities, etc. So I think your challenge is a really good one, and I think it's one that we have to accept. We have got to continue to work on, because getting people who've been through the process to be able to feel confident about exploring that with us and sharing their experience with us is pretty tough, actually, if I'm honest.
Thank you. If I could come in, we work very, very closely with the sector organisations. Whether we fund them or not, we've got such a diverse range of wonderful, wonderful third sector and community-led organisations. And one of the things that we do offer to them is basic safeguarding training, so that we heighten their awareness around where there might be individuals that are either not engaging with services when they really clearly need them, or whether they might be at risk of harm. So the role that our organisations in our communities play is really quite vital in flagging up safeguarding matters. So to some extent that happens, probably less so from neighbours, but more so from community organisations that are wrapped around local communities.
Thank you. Okay, Councillor Gibson.
Thank you, Chair, and thank you for this report and all the great work that you do. It's great to see you again this year. You know, always look forward to you coming and bringing this report to this committee. And I always ask the same question, so I'm going to ask it again, because it's not reflected specifically. I don't think people with autism and learning disabilities not specifically reflected. And I understand the reason for that in the report. There are a couple of mentions of learning disability, in particular, that out of the needs of the people that are being reported through to service, it's 18% of them have a learning disability, which is the second highest. I don't think there's any reference to autism. But yeah, my experience of working with people with learning disabilities, or mild learning disabilities, and people perhaps that just that are above that threshold for a diagnosable learning disability, so learning needs, perhaps people with complex autism, and trying to safeguard them when they have there is a sort of criminal element to it. So I'm sure a lot of people here will have watched what's it called, Line of Duty, and then you'll remember the learning disability person there being cuckooed, and his flat was being used for criminal activity. I always found it very difficult to get a response from the police because of the issues around capacity and evidence, and get them to act. So it was sort of left down to social services to be able to respond. I wonder if that's changed. Are we seeing an improvement? Do the police get it when it comes to safeguarding people with learning disabilities or learning needs, and sort of capacity in some areas of life to make some bad decisions, but perhaps not in others? And the complexity around that, and are we seeing an improvement? I mean, I note that you've engaged with the Bridge and some of the other third sector partners. What are they telling you about people with LD and autism?
So, what I can say, I mean, I think the statistics you're referring to are kind of national collections, and they'll have defined definitions that mean learning disability would be a catch-all heading for some of the people that you're talking about. What I can say is that we've listened to groups, some of whom represent the people that you're talking about, and particularly the issue of home takeover and cuckooing has come up. So as a board, we've spent some time looking at just where work is at in the city on that, and we're at the point of defining some some next steps in terms of the action we want to take. I think in doing that, we'll want to have some further conversations, and some of those organisations I'm going to be engaging with over the next 2 or 3 months include organisations who represent the people that you're talking about. I'm absolutely clear that there's some fantastic work going on in the city, and the police are a key partner to that work around cuckooing and home takeover. I can't say anything more than that. I think the challenge you always bring me and us, Councillor Gibson, is just how far do we kind of track our way down groups with specific needs, and how far do we continue to kind of work at a more generic level. And I think I'm pretty clear what your kind of advice to us would be, which is you've got to look at the specific needs of some of those groups, and clearly in some of the work we're doing, they are going to be people who are going to experience the potential downside, negative side of home takeover, kind of organised criminal activities. But equally, we've got to look across the whole, I suppose, and be clear about the kind of key issues that affect a range of the populations and the citizens that live within Leeds. All I can do is assure you that we're in contact and talking to some of those organisations. We're not building specific strategies, if I'm honest.
Yeah, I was scarred by my experience of working in LD services. That's why I bring it up with a couple of cases. One chap, it wasn't in Leeds actually, who ended up having to put out of area in the most expensive placement you can imagine, because he sort of living semi-independently. And he kept we were managing his money, and he kept coming to us for more money during the week, more and more frequently, and when we'd say no, we'd refuse, because for all sorts of reasons, and we've been through all sorts of processes to see whether or not we should refuse, but we decided collectively that we should. And it wasn't until later on it dawned on me that he was clearly being exploited by gangs, and clearly I did some training on it. And he was clearly they were stealing money from him. He was saying who it was, but he said he was buying drugs. So the police were like, well, that's his choice. But it wasn't, he didn't have capacity in that, and he was being exploited. And, I always felt very personally that I sort of let him down, and I've not had the training. I think about that all the time. But, later on in my career when I had similar cases, I was able to pick up on that, but I did find that I was coming against a bit of a blocker when it came to the police, because we needed them to take action. And actually there was a lot of crossover between LD autism, learning needs, and kids in residential homes, looked after children as well, and that crossover, and it was really bad for them, and really bad for everybody really. So that's why I keep bringing it up. Because, I lost a lot of sleep over that particular case. Yeah.
Yeah. No. Just quickly, Chair. Sorry. So just quickly, just to say that Leeds is doing some really sort of leading edge work, and they're doing that in conjunction with the university. So Safer Leeds, us, Children's Partnership. There's been huge amounts of research done, and there's real awareness across the agencies, including the police, around the issues of home takeover. There are approaches in bits of the city which bring players together fast if there's a referral or a concern, and the work that's been done in the city is leading work that's now kind of taking a policy position at a national level. So all I can say, I can't speak for every case, but what I can speak for is a real strong commitment across the 3 partnership boards in Leeds and our partners too, to take seriously the issue of home takeover and to be absolutely clear about who that targets. And it's some of the people you're absolutely talking about.
Thank you very much. Okay, Councillor Jones next.
I'm actually looking for some advice, which is unusual. I reported what I got regarded was a person who was at risk. He wears the same T-shirt for months on end and all that goes on. He decided, for whatever reasons, he didn't want to engage. That position has now deteriorated. Should I report that again, or how do we get around? He will have a conversation with me, and it's quite clear that he's in a difficult situation, but he will not engage in any shape or form. He's absolutely clear about that. So where does that lead? I feel bad about it, I'll be absolutely honest. I find it very difficult. But how should I now go back and have a second attempt, or should we just let it be? My concern is one day he's not going to be there, and it may be 3 weeks later before we work out why he's not there. That's my concern.
So, Councillor Jones, I suggest you'd have a conversation with Shona outside of the formal meeting.
Thank you, Richard. I think that's sound advice. Okay, Councillor Bromley. Councillor Bromley is the last on the list, so this is your last chance, but only if you haven't already asked the question, because we're behind time.
Promise to ask all the questions needed. Firstly, I just wanted to thank Shona and the team. I know that you've supported when I've asked for casework locally, and the response to that and the feedback from that as well has been really positive. The first line staff visits that have gone out, so thank you so much. My question is sort of leading more into what Councillor Ritchie asked around use of public bringing in for intel, information, awareness and understanding, and neighbours were the words used by Councillor Ritchie. But I sort of wanted to tie it in with leaning into the domestic abuse side of things. We have a local organisation that I was invited to go across to a show called Red Flags, and there was also Leeds Women Aid in the audience, and we learned a lot from that show. It was young adults predominantly that it was sort of informing on, but it was the terminology, but also just the information around healthy relationships and boundaries, actually things that we've not really been educated and grown up to be educated in. That I can imagine part of the public services is sort of, that's part of the information that's given in training, but public awareness is actually quite thin on the ground with these sort of like flags, which is what the show was called. And so I wondered if part of our work really to strengthen our work as a city as well would be how we're putting that out, that information out to the public, so that there's a general awareness and informing people, so that not just for themselves but also be able to identify things for their neighbours and communities, and there's just a wider understanding overall.
Yeah, thank you. So I think public awareness is a massive issue, and it's a journey. We're taking a journey that, in a sense, on adults with care and support needs, that we've taken kind of nationally, locally in the city on domestic abuse and around child protection. Where there will be you'll get a different response. I think if somebody was told, look, I'm concerned about a child next door, I think people quickly think about taking an action, wouldn't they? It's different, what do I do about the guy? Well, Councillor Jones just raised, what do I do about somebody who's kind of not looking after themselves, or I think's kind of maybe being targeted by the local kind of guys who are running the drugs set up in this neighbourhood. What do I do? And I think it's a much more difficult thing for people to get their heads around, and it's huge, and it's not about children who don't have who we're here to protect and support and don't have they have certain rights and responsibilities, different for adults who can make decisions for themselves. So what we're doing is we're continuing to work in terms of trying to raise awareness. We're not doing publicity campaigns, sides of buses and things like that. I'm not sure there's any evidence that works. What we're doing is we're continuing to work with neighbourhood groups. We're working with faith groups. We're working with well, I've had conversations with the further education, higher education institutions in the city. We're continuing to have conversations about this is an issue and how do you respond and how do you feel confident about responding. And we're doing some very particular work at the moment around ethnically diverse communities. So we're just at the point of engaging in some real deep engagement with ethnic diverse communities in the Bermtoft area, which Caroline has taken a champion role on. And I don't think it's subject to. I don't think you'd assume there's one golden bullet. We've got to keep doing a whole range of different things about raising people's understanding, awareness, and confidence. When we talk to people, particularly ethnically diverse communities, their issue is confidence and being clear that I can be confident that you'll make a culturally appropriate, sensitive response, and I'm not just going to see somebody whisked off into care or whatever. So we've got a long journey and a lot to do, but we're absolutely determined to continue to work on that agenda. There's not a public awareness campaign, there's a whole range of work, and the ethnically diverse piece would be one bit of that.
Thank you very much for that, Richard. That's really helpful. So I'm going to bring this item to a close, but I'd like to thank you on behalf of the board for the work you do. I also think there's, hopefully it looks like you made notes as you went through. I think there's probably some sort of suggestions and actions that for you, which we look forward to hearing about in the future. So thank you very much, and I'll close that item. Just as I think Mitch is allowed to leave now. Just as we, before we go on to the next item, we've got two people who have arrived at the table. So, do you want to introduce yourselves, Councillor Arif and Steve? Thank you.
Hi, I'm Councillor Salma Arif. I'm the Exec Member for Adult Social Care, Active Lifestyles and Culture. And apologies, I was a little bit late, Chair.
Good afternoon. My name is Stephen Baker. I'm the Head of Active Leeds for Leeds Council.
Super, thank you very much. Okay, so we're moving on to item 8. For those of you who have the pack in front of you, that's page 33. I'm going to do it in 3 sections. So we've got the public health section, which is pages 34 and 35 and 39 to 55. Then we've got the adult social care, and then we've got the active lifestyle section. So firstly, I'll ask Tim if he's got any comments on the public health section. Or Councillor Flint, do you want to make some introductory remarks?
Yeah, if that's all right, I'll just go first, then hand over to Tim. Thanks, Chair. So just as a reminder, this report comes twice a year, so it was last with you in June, and it covers key population health outcomes for both children and adults and operational or service use indicators. So these updates shows updated data in 5 areas. So I'll just run through the kind of highlights, I guess. An important measure of the health of our city is life expectancy at birth. In this most recent report, we see that both for males and females, life expectancy has increased slightly, but this data will need to be monitored over coming months to establish if this is really the start of a positive trend. But it's important to note that we observe the significant gap in life expectancy between the most and least deprived parts of Leeds. And this inequalities gap is present in other indicators reported this time, including recorded diabetes. And in terms of recent improvements, I'll just pick out the proportion of women breastfeeding at 6 to 8 weeks as an indicator. This has increased, driven by continued improvement in the most deprived parts of the city, which is good news. Also, rates of sexually transmitted infections have also decreased significantly in the most recent period. Both these improvements, amongst others, are associated with the delivery of a comprehensive public health programme, which I'm sure you know includes breastfeeding supported by our children's centres, which have been accredited with UNICEF as part of their UK Baby Friendly initiative And the work with sexual health services through initiatives such as single point of entry for sexual health services, expanded digital options and targeted outreach. All these developments form part of wider efforts to strengthen sexual health provision across the city. So those are kind of the notable highlights, but I'll pass over to Tim if that's all right to expand.
Thanks, Councillor. Really nothing to add other than just the clarification. We often use this, and really just to be clear, the point about the gap in deprivation which underpins so much of this and inequality gap, we talk either, in this case, we're comparing those areas in the least deprived, in the most deprived 10% areas with the rest of the city, and that's where you get this roughly 10-year gap in life expectancy at birth between those areas. Other times we compare different wards, and if you compare the most deprived ward with the least deprived ward, there you get about a 12-year gap. So if you see that, that's the reason why you might see those different figures quoted. But thanks, Chair. Happy to take any questions.
Thank you. Okay, members, do you have questions for the public health section? Councillor Blackburn.
It's a quickie one. Looking through recorded diabetes, which is sort of slowly increasing. I'm at the age now where every time I go to the doctors, I seem to have to give blood. And one of the things is check sugars. And I know quite a few of my friends, including myself, have been sort of like on the edge of diabetes too. At what stage do you count somebody as having diabetes? Because it would seem most of my friends are now nearly diabetic too, but some of them are not quite there. So at what point do you actually count somebody as having diabetes too?
So that's based on, as you say, measures of blood glucose, and there's basically cut-offs. What we have is what's called pre-diabetes, which is where it's recognised you've got a sort of healthy range. Then there's a range that's recognised as being what's termed pre-diabetes before you get to the actual cut-off where you class. So this will only record those that are classed as being formally diabetic, but it is obviously enormously helpful and valuable from a medical and a clinical and an individual point of view for recognising that cohort of people, a group of people who are in that almost at risk of becoming diabetic, but there is lots that people can do about it. So people can make very substantial changes to their risk of diabetes by amending factors such as smoking, drinking, diet, weight, etc. So that's a real reason that they do that. I don't have the exact cut-off figures to hand, but there are cut-offs. Your colleague, I think, might have them, who's next to you by the looks of it. If I could just say one final thing, the other thing about diabetes, it is an indication that there is an increasing risk across the population that will be directly related, for example, to increases in overweight and obesity in the population. The other thing to see there is that huge difference in that figure between the most deprived and the least deprived, which again indicates that level of inequality and that social gradient. But also it is important that we keep doing the work to make sure people are diagnosed and to get those figures up to date as well so we can address it.
Can I just ask, do you think that the slight increase is a result of more people being tested?
Yes, to a degree. So it's a funny one, this one, and it's a bit like some of the other data that we have. We don't actually include it in here, but things like chlamydia rates, where actually one of the aims is to increase the amount of people that are recorded, because we know often there's an undiagnosed amount. So there's a bit of a balance here. By some of the increase is going to be because we're actually doing a really good job, I say we collectively, in terms of the sort of the health system of identifying those people that have got it. But I think it also does reflect a genuine increase in the amount of people that are, which you would expect, because it mirrors the proportion of people, for example, that are overweight, and there's that very close correlation between those two.
Thank you very much. Okay, Jonathan.
Thanks, Chair. I just wanted to return to this kind of ongoing issue of the gap, the 10 years or the 12 years gap, depending on how you manage it. And it's there in every discussion that we have in all sorts of forums about about inequalities. Do we have any evidence at all that there's anything that is going on at a really micro level that is starting to address that, and whether there's any change? Because it almost feels like we kind of have this discussion, that's how it is. So, is there any evidence of movement?
Can I so I guess the other aspect of this is, I think is almost the healthy life expectancy thing, which in my view is an even more important indicator, and is an even bigger gap. And I'm sure Tim's going to say something about Marmot City stuff, which is hopefully part of it, but there's definitely more to be done, isn't there?
Absolutely, Chair, and I'll come back to the healthy life expectancy in a second, if that's okay. I really take your point on board, because there is a real risk here that we just come back to that same point and it feels very static and as though it's just a fact of life and we just need to sort of accept it and there's nothing much and it isn't going to change. I think what's really important is to just take that slightly broader view. So if you look at the view of life expectancy at birth over, say, the last 20 years, it's changed markedly. Not only has the rate changed, but also the gap between it has changed radically. So what we saw, just in terms of the overall rate for men and women, is that was steadily increasing up until the mid sort of 2010s, and has then plateaued, and we actually have almost seen a slight tail off and a fall, particularly for women. So you've got an overall trend there where this increase that was happening has flattened off, but and that is seen internationally too, and there's conversations about why that is. But critically, what you saw was a real reduction, a very sharp reduction in the inequality and the gap between life expectancy between the most and least deprived, running right the way through to around about 2010. And then you've seen that gap gradually increase and maintained since that point. Now, there's been quite a lot of commentary around that. I mean, I don't want, it's not for me to be sort of political about that, but there is quite a lot of commentary and around the sort of era nationally of austerity and the impact that some of that might. I think that's quite commonly accepted, that did have an impact on that. What we have seen more recently is a slight closing in the last one or two periods, so we're just sort of hoping that's the beginning of a closing trend. The reason I say that isn't, as I say, in any way to be political, but it is to make the point this does change, and there are policy decisions which do impact on life expectancy in terms of both the trend and, critically, the gap in inequality. So this is absolutely amenable to changes that we make around a whole range of things that impact, all the things we know impact people's well-being and general overall health.
Just before we go down this rabbit hole, there's our next meeting is themed on health inequalities. So I'm going to suggest that we part the health inequalities piece, because we're going to have a whole meeting on it in February, which I think is mega important, which is why we've got a whole piece on it. Is that okay? So,
and if you just want me to just say very quickly in a nutshell about the healthy life expectancy, you're absolutely right. It's there. It's big. We don't have the same granularity of data on it and can't monitor it to the same degree. Hence why it's not in here. That's all.
Okay. Thank you, Councillor Ritchie.
Thank you. Two questions from me. On page 46, the graph of likelihood of current smoking (self-reported) among adults with a routine and manual occupation. Could you just explain what the y-axis is, the numbers 0 to 6, and what that actually is telling us, please? And secondly, on the gap, the employment gap between those with a learning disability to the overall employment rate, that's gone up. We're now at just about England level. Now, I know there's a great deal of work. Indeed, I've just this morning was at the Learning Disability Partnership Board, but we don't, we seem to be making no progress, unfortunately, on that. So perhaps you'd comment on that as well, please. Thank you.
Okay, thank you. And if I can just clarify, was the second point on learning disability? Sorry, I'm just trying to find the...
Yeah,
that's
page
the gap in,
47.
yeah, that's the gap in employment.
Yeah.
So very happy to comment on those. The first thing I'd say is just to be mindful, neither of those indicators have been updated on this occasion, so they're not new data. It's a good question. I'd not prepared this because of these not being new data. I think looking at the smoking data, I think it's a likelihood ratio. So that's saying that so I think it's a likelihood ratio of saying how much more likely is smoking likely to be if you've got a routine and a manual occupation than the wider population. So it's saying that in Leeds, they're not statistically different, but what it's an indicator of is basically that inequality. So the higher the likelihood ratio, the higher the level of inequality there is between essentially people that are classed as being more deprived or in those manual roles than the wider population. So what that says is in the latest period that you can see on that chart for Leeds, there's been a very slight increase, but it just brings it in line with the overall rate. Ours has gone up and down, and it's a fairly flat rate with a slight reduction in inequality at the end for the England rate. But we can talk about that a bit more, if you like, when that data's updated next time. I can make sure we can define it.
Yeah, I think what Councillor Ritchie is saying is it might just maybe it's a technical question that you can follow up. Is what's the 1, 2, 3, 4, 5 mean?
Yeah,
it's
and
just
that's
a
the
factor, the likelihood.
So I'll follow that up with an explanation.
Like technical.
I think
yeah,
that's
perfect,
what it is. We'll
thank
make
you.
sure it's more clearly labelled, because you've tested my my stats knowledge there by putting me on, but I'm pretty sure it's a likelihood ratio, but I'll double check. It's a gap percent. Yeah, and then, sorry, the second question that you had was regarding to the gap in employment between those with a learning disability and overall employment rate. I can get back to you. I'd rather, if it's okay, come back to you with a response. I completely note and acknowledge the lack of improvement and the concern that there is around there. Obviously, we've not commented specifically on that one in this report, with that data not being updated on this occasion, but I'm very happy to take that back, pick that up with the relevant colleagues that lead on that area, and make sure we can pick that up at the next performance report. And if there's anything to follow up that's relevant with your outside counsellor, Richard, I can certainly do that.
Thank you. I think it would be good if you could, when you get that information, share it to Angela, and then we'll share it around the board. I think that's quite relevant.
Happy to do that.
Thank you for that. So that's the public health section. So on to adult social care section, and you've all got this in your notes, but I'll just say it. So it's pages 35 and 36 and pages 56 to 66 in the pack. Let Councillor Arif make some introductory comments.
Thank you, Chair. So this report provides a comprehensive overview of outcomes and service performance across two areas within my portfolio. That's adult social care and active lifestyles. Starting with adult social care, the overall picture in relation to the ASCOF measures, that's the adult social care outcomes framework.
Councillor Arif, can you just move your microphone a bit closer? And Tim, can you just turn your microphone off? Thank you.
Apologies.
So starting with adult social care, the overall picture in relation to the ASCOF measures is positive, with 13 measures out of 23 having improved since the last available result, while only 2 have declined. The results for the remaining measures are not yet available. Our proactive strategies are delivering positive progress, including significant improvements to personal social services, with 6 out of 7 measures improving. This places Leeds first in the region and among the top performers when compared with our peer authorities. Growth in our social work teams and a reduction in staff over, which is positive. Strengthened processes for identifying and responding to potential safeguarding concerns, and obviously we've had a good discussion in the early item. The report also identifies areas where further progress is needed, Chair. These include pressures on care home capacity, the uptake of direct payments, again, and the waiting list for Care Act assessments. We are not standing still, and these issues and targeted action plans are already in place to drive improvement. Chair, if I may please publicly also thank Shona for her support to me as an exec member, and I wish her all the very best in her retirement. But it's been a really genuinely wonderful to work with you, and thank you for all your commitment and compassion over the years, Shona. Chair, if I may move on to active lifestyle. Or do you want to
in a minute. Yep. We'll come back to it.
Sure,
okay.
Thank you.
Do you want to say anything, Caroline? No. That's great. Okay. So questions on the adult social care stats that Councillor Harris just went through. No. Great. Okay. On to active lifestyles. Thanks, Councillor.
Sure, Chair. In terms of active lifestyles, physical inactivity in Leeds rose from 23.9% to 25.4% between November 2023 and November 2024. Over the same period, the proportion of residents classed as active fell from 66.4% to 64%. While this raises concerns, Leeds continues to perform well compared with national and regional averages. Sport England has also estimated the annual social value of sport and physical activity in Leeds as being at around 1.34 billion. This figure reflects the benefits to individuals aged 16 and over, including improved well-being and the broader social impacts. The team at Active Leeds continue to work across the system to improve people's lives for the better and make Leeds a place where everyone moves more every day. Active Leeds will continue to prioritise their resources along with working with partners, stakeholders and community themselves to impact those in greatest need. Again, just want to say thank you to the colleagues at Active Leeds. They genuinely do a lot of fantastic work and in the heart of our communities, and sometimes they just get on with it and it's not always sort of seen. So I just want to say thank you to the team for all the work they do. Thank you, Chair.
Thank you very much. Does Jen or do you want to, or Steve wants to make a comment? Yep. Okay.
It's just worth noting that the actual score itself from November to November 2024 hasn't changed since last time we reported it. It is done on an annual basis now, so hopefully for the next round we'll have that updated from Sport England, so we can report on that basis. But just to say, it is the same as it was last time round. Thank you.
Thank you. Yeah, I guess it is a shame it's gone backwards. I think the question around the health, because the obvious question is what else can we do and what are the implications. It's interesting that Councillor Blackburn mentioned diabetes earlier, and in my mind there's got to be a link to moving regularly and size and diabetes. That would be my observation. I can see some nods. I think I'll make that as a comment rather than a question because I think it's self-explanatory. Are there any questions on this item on the active lifestyle section? Councillor Bromley?
Can I comment? Yeah. I just want to say how much have I enjoyed joining the Place Efficiency Board alongside Councillor Scopes, and how, the brilliant work that's going on there in terms of Active Leeds as well, and your involvement with that with an event just recently last year. Thank you.
Yeah, thank you, and hopefully play encourages movement, and getting that play ingrained when we're young hopefully helps us do better when we're not so young. Councillor Jones?
As somebody who uses the surface probably 5 times a week, 6 times a week on a good week, my question is, and somebody who coaches athletes, I'm going to come quite clearly, how do we encourage more of our young people to be involved? Also, there's a difficulty, I believe, in cost for some people. How are we going to address that? Because I think there are people who would love to go take some more exercise, but unfortunately it's cost prohibitive. Now, I accept that the offer that the council makes on active lifestyle on the sports centre is an absolutely fantastic offer, but how do we get more of our older people particularly? I go up at 8 o'clock in the morning normally, and it's generally a lot of older people, to be fair, but yeah. And the other thing you've missed in the report is that the Armley Sports Centre has just been updated as well, and that is an absolutely fantastic facility. In fact, to be honest, I think that's the best in the city. But how and what measures are we doing to try to increase that number? And it's impressive, I'm not arguing that, but I think there's still more that we possibly could do.
I'll come in and then I'll bring Stephen. I think you're right. There's always one more we can do in terms of increasing participation. Actually, looking at the membership numbers, they're at the highest they've ever been post-COVID. In terms of the cost, to some that is a barrier. And actually in Army specifically, some years ago, we had, if I'm not mistaken, is it still around? I'm sure where if you're on benefits and you're considered as somebody who's inactive, we actually reduced the cost of the membership, and that had a lot of benefits for people. I'd love to take that across the city, but that might have some budget implications. But bear with me on that. But actually, you know, as I say, from an Active Leeds perspective, what I find is the team, it's not just about what happens in our leisure centres, it's also what's happening in our communities. And the fantastic thing that the team does with Active Leeds is, and the work we've done in sort of particularly in the inner city areas, is encouraging people to walk it, ride it. And one of the things that we're doing in my neck of the woods in Bermondsey and Richmond Hill and Gibson Hare Hills is that active travel scheme. And I think these are little things that where we can get some additional funding, the team is all over it. But yeah, we definitely need more people in our leisure centres. And actually, one of the things that has helped increase the membership is because of the investment that the team's put in within Active Leeds. We're constantly investing in our leisure centres. And in terms of cost, last I checked, Councillor, actually Leeds, from an Active Leeds perspective, is probably the most competitive regionally when it comes to the costing and the membership that we charge. And we have had to increase some of our fees, but again, comparatively, we're doing really, really well. So that's something that we'll certainly keep an eye out on. But I'll let Steve to come in with a little bit more detail there. Thank you.
Thank you, Councillor. And yes, glad to see you kind of attending the sites and making use of that kind of membership. I mean, as Councillor Reef's kind of just highlighted, our membership points and pricing points are well below kind of West Yorkshire levels, even not only nationally and the likes as well. So there is that affordability, but we already know that there's always going to be those ones that need more extra support. So there are a number of different packages and programs that we kind of deliver that help support those individuals as well, whether that's people with health conditions, whether that's the older generation as well. Then we are finding actually the membership numbers, when we're looking at the demographic side of things, we are seeing the greater number of older people actually attending the sites as well. So it is showing that we are kind of having, but as Councillor Rees already highlighted, there's always more we can do and more promotion we can do and more kind of that side of things. We are reviewing our pricing side of things just to make sure from a member's perspective we're kind of still give that value for money, but also how we support people, especially during off-peak times where we might have a bit more capacity within our kind of operations side of things, that we can offer lower discounted kind of memberships or kind of activities during that period of time as well. So those are the kind of things we are looking at. So hopefully I'll be able to bring something back once we've kind of explored that a bit further afield. Obviously we've always got that budget constraints in mind that we kind of need to make sure we're challenging on that front, but we're trying to do as much as we can on that front. In terms of young people particularly, we do a lot of work with schools and colleges and the universities as well to try and build up that kind of educational side of things in terms of qualifications and the likes, and the team do go out into schools and build up a lot of their kind of confidence levels to be able to take part in sport, but then also give them qualifications to actually off the back of that into coaching and those type of things as well. So it does rely on our working with the likes of the Rhinos and everyone else within the system really, to make sure it's as easy as possible for people to kind of get those qualifications, because again there is a cost associated with those qualifications, as I'm sure you appreciate as well. So again, it's how we support on that front, but we are working from a network point of view from Sport Leeds to make sure that coaching and young people particularly are given that support to kind of, you're right, that there are future kind of volunteers and the likes, and we need to kind of work on that front in greater detail, really.
I was just going to pick up on Councillor Reed's point around communities, and a lot of the work that we do as an active Leeds service, as a culture service, and then as a green space service actually happens in our parks and green spaces, and it almost goes kind of under the radar, and it's unseen. But the work that we've done through our tennis clubs, creation of skate parks and multi-use games areas, which we've got a programme of play zones coming forward later this year to improve some of those facilities within some of our parks, is really powerful, and it's free access for things like that. But cost prohibitive activities aren't just about doing the activity itself. Some of it's about kit and equipment, and I think it's probably right to point out the kit exchange that the service brought forward, which has been nationally recognised for innovation and supporting communities to having access actually just to trainers that fit people's feet, or shorts or tops or sports bras and everything else that goes with that, to be able to afford not just to turn up and pay to play or get free events, but actually have the kit to wear as well. So all those things we kind of bring into the whole system. Moving forward, we've submitted our Sporting England bid, which is a 1.9 million bid with 1.1 million of additional funding to support programmes moving forward for the next 3 years, and we'll find out in the spring whether that's been successful or not, and that will allow us to continue some of the programmes you see here, but also start to expand and be more creative with the opportunities to engage with people.
Super, thank you very much. Okay, so just as I move this item to a close, I'll just make a couple of comments as well. I think you're absolutely right around the using outdoor spaces which are free, so things like South Leeds Moves is happening again this year, and it just encourages people to use local green spaces. That's really positive. And things like my 12-year-old loves going to the gym because he can go with his mates now, and at a supervised session time, and because I'm not there, it's much better for him. There you go, that's life. So that's really positive. So thank you very much for that. I really appreciate your time and your work on these items. So with the next two items are finance related, and we've been going for 90 minutes. So I'm going to suggest we have a comfort break now, and then we'll come back at 3:05 on that clock. So if you want to move to or from the table, feel free. And I'll just pause the meeting briefly while we have a comfort break, and then we'll be back. Thank you. We're going to restart the meeting. So all the side conversations, let's pause those until at the end of the meeting. So we're going to move on to item 9 on the agenda, which, if you have the meeting pack, is on page 71. If you're watching this video, you can just put into any search engine Leeds City Council Adults Health and Active Lifestyle Scrutiny Board and follow your nose, and you'll get to the meeting pack. It's publicly available. So financial health monitoring is this item. I don't know if Councillor Arith was making any comments or whether we're going to go to Caroline.
I do have some opening remarks, if I may, Chair. Thank you. So at month 7, the adults' health financial position is showing a pressure of 21 million compared to the budget. The main pressures relate to the care packages and client income, where we are seeing increasing demand for services, more complex needs, people needing care and support services for longer, and pressure on income as client contributions are affected by cost of living. The national picture of adult social care budget is also very challenging, Chair, and the pressures being seen in Leeds are reflected among many other local authorities. In terms of efficiencies, Adults and Health are forecasting to achieve 27.5 million of budget action plans this year. Adults and Health have worked hard to deliver these savings, and the financial position would have been significantly worse without this. Due to the significant complexities of some Adults and Health budget action plans, some delivery of services will move into the next financial year. However, work is ongoing to support this. Good arrangements are in place to monitor the budget and savings delivery within Adults and Health, including regular detailed analysis and reporting at the Adults and Health Budget Review Group, Directorate Leadership Team and Member Oversight Board. Despite this ongoing work, there is significant risk of additional pressures as we move through the rest of the year. This is particularly the case on the demand budget due to the size of the budget and the unpredictable nature of trends. For context, the budget is just over 300 million, so only 1% variance equates to around 3 million. Adults and Health are very mindful of the financial position and will continue to work hard to support this, but this is within the context of our statutory responsibilities under the Care Act to ensure we continue to directly provide all commission care and support services for people to help them live healthy and independent lives. Shall pass on to Caroline to take it from here. Thank you.
Thank you very much, Chair. So, as you can see, in month 7, we're reporting quite a significant overspend position, and as Councillor Arif has already alluded to, that is very much driven by increasing numbers of people who require care and support, and even more than that, the complexity of need, and also the fact that people are actually living longer, which is the most wonderful thing. We're really pleased that people are living longer, even though it is sometimes with ill health and healthcare needs. But what that means is that when we compare with previous years, what we're seeing is what we call length of stay. So somebody who needs a care home placement or a home care package, or a person with learning disabilities living in a supported living setting, they are living for longer and requiring the care and support for a longer period of time, and it's increasing as well. We find that with home care, a lot of people are requiring larger packages. Again, it's really good that we're putting a lot of energy and effort in supporting people to remain living in their own home for as long as possible. But what that does mean is that it places a pressure on our budgets. Added to this is the fact that we have had for year after year after year, year in, year out, quite substantial savings and efficiencies that we've had to deliver, quite eye-watering savings targets, most of which we have delivered on, and we have met our savings targets. Some, however, including now in this reporting period for month 7, we're identifying some where we have slipped delivery of savings or when we're not actually going to be able to recover. One of those is around income, client income, people who contribute to their care and support packages. And I have mentioned at Scrutiny Board previously that we are seeing a reduction in the number of people who will contribute to their care. We're seeing a number of people who have previously funded their own packages in entirety coming to us for local authority funded support. So a range of different pressures are being identified on top of the complexity of need, and that is what accounts for our current overspend position.
Thank you very much for that, Caroline. That's quite helpful because my question was going to be around, so on page 77 there's the overspend is 21 million, and then on page 85 the pressure is 15 million. So it's a comment then, I guess, is the 6 million gap is the expected slippage to date in terms of not making the savings we expected? Question. Sorry, introduce yourself first, sorry.
Will do. Thank you. Good afternoon. Louise Hornsey, Chief Officer, Resources and Strategy. So the difference in the figures, the 15.5 million that's in for demand pressures, that does purely relate to those care packages, which does include the slippage around some of the savings delivery. The balance really is we have a pressure of about 6 million around the client income budget.
That's really helpful. Okay, Councillor Lay, if anyone else wants to comment, please indicate.
Thank you, Chair. Yes, just off the back of Councillor Scope's question, really, I was going to ask the same question. I'm going to slightly change it then, because he's asked exactly the same question. £6 million adverse change in month 7. Month 7 is October. I'm not great with figures, as the pre-meeting found out. That's £200,000 a day, roughly, overspend. What is that being spent on? Because that's £8,000 an hour? I know that's a really simplistic way of looking at it, but will that happen every month? Will month 8 be another 6 million? Or is there something special happening in October?
If I could come in, actually, the trend is that the demand is continuing to increase. We do have very, very good benchmarking data and tracking data. So we benchmark current year spends relative to previous year spends, month by month, and we identify trends. And what we are seeing is a trend that is continuing increase in demand over the course of the year. In previous years, we've seen quite a bit of fluctuation, and particularly as we come into the winter period, actually a reduction in the numbers of placements and the numbers of packages of care. We're not seeing that trend in the current year. We're seeing the trend continue to be upward. So we are worried that the position continues to get more and more challenging, with an increase anticipated. Hopefully not for the full duration of this financial year, but at the moment the numbers of people requiring care and support is increasing. And as Councillor Arif has said, a 1% increase in demand equates to £3 million.
Thank you. Okay, Councillor Ritchie.
Thank you. It just struck me, we do hear it all the time, that people are living longer, which is a real wonderful thing. But actually, if we go back to page 44 and we look at the life expectancy, it's stagnated for over 10 years. So is it actually a factor that there's just more people now? Because I know that's an average, so some people will be living longer, but if the average is, that means some are dying younger.
So the data on life expectancy is per 100,000 of the population, and it's the whole population, isn't it? As opposed to those people that require care and support and that are council funded people. So it's a smaller cohort of that 100,000, where what we're seeing is people who require health care and social care are being supported to live longer than they have been previously, and our budgets are set on previous trends, previous numbers, and what we're seeing is for the cohort of people that require care and support from the council, that number is definitely increasing.
I think that's a really interesting statistical question, because I think the number is the life expectancy at birth, which is the number in the public health report. And obviously, there's a few peaks where people are most at risk of dying. So it'd be a really interesting piece of work to understand how that's happening. I'm not sure necessarily that's entirely relevant to our board, but I do think it's a point well made, and it's a challenge worth making. And I think Caroline's comment around specifically people Leeds City Council cares for is relevant. Yeah. Good. Okay. I can't see anyone else coming into comment. I think it's just worth stating that obviously our board's job is to scrutinise the budget position, and obviously the budget challenges are concerning to us, and I think it's important for us to note that. And so, but we also appreciate you being honest about the ongoing challenge, which may mean that we need to talk about this again at the next meeting. And I think it'd be helpful just to get some more commentary around the size of the figure. And I think Councillor Lay, whilst I don't always agree with the working stuff out per hour, it sort of brings home the size of the number, and so it's worth just trying to understand that a bit more. So maybe outside the meeting you could give us a little bit more narrative on what that looks like in terms of the number of extra people that the council is supporting, because obviously that's the important thing. How many people are we supporting is really important. Okay, great. So we're going to move on to item 10, and so this is the budget proposals, and just a couple of comments for which were broadly made in the pre-meeting, but I think it's worth making in the public meeting as well. Firstly, that we, the board, have had a separate meeting about this, and comments that were made in that private meeting will also be included in the comments that this board has made. So if you made a specific point in the private meeting, that'll still get in the report, and then that'll be in the public record as well. I think that's important. And the other thing is, I think the comments I made in the pre-meeting around the chairs of the 5 scrutiny boards, all of the view that maybe there's not as much information as early as we would have liked, and we hope there'll be more information next year. But I think it's worth saying that out loud. I think Alan is going to make a few introductory comments and whiz through some slides. But do you want to introduce yourself first and then go through your slides, and then we'll move to questions if there are any. Thank you.
Thank you, Councillor. I'm Alan Ellis. I'm Head of Finance who supports adult social care and public health. And I'm just going to give you a quick overview of how the budget has come together for the proposals that are going forward to February Exec Board. So slide 3, just quickly give a quick overview of what went to December Exec Board, changes which have come in the provisional local government settlement late December.
Can you just move your microphone a bit closer? Maybe I'm a bit...
Sorry, is that better? So talk about the provisional local government settlement, and then how we've closed the gap, and then just briefly touch upon a couple of the savings proposals which are coming forward to February Exec Board. So moving on to the next slide. This just gives a quick overview of how in the December Exec Board update, there was additional resources of 70.4 million available that were projected to be available to the council. And I guess the key thing there is just recognising that there was the 2.99% general council tax precept and the 1.99% adult social care precept were modelled in there. and that's generating an additional 41.5 million at that point. So next slide. Again, this is just showing how much recognising everything that's come out of that month 7 position in terms of pressures around demand and demography. What you can see there is 41.1 million going into adult social care. This was in the December position. A later slide will show that we've put a further 11 million in for demand. So you can sort of see everything that members are saying around the risks and concerns for next year. We're very much trying to get the resources there to ensure that we don't have a repeat of this year. Next slide, please, Angela. Again, so at December Exec Board, there was a gap of 101 million for 26/7. That's been closed by a multitude of 2 things. One is the additional funding from Fair Funding Review and the detail that was in the local government policy statement. That was 62 million, and further savings of 39.5 million. And within the 39.5 million, there's just over 20 million around the cross-council programmes. So then, in terms of the provisional local government settlement on the 17th of December, talks about it was a 3-year settlement. So again, that brings stability for future planning, consolidation of grants to simplify funding streams. And again, there was quite fundamental changes around the business rate system. In terms of the detail, what it specifically meant for Leeds City Council is in 26/27, there was an addition just short of £31 million of additional resources against what went to the December Exec Board paper. And you'll also see there's growth for future years as well. And there was also a couple of other specific grants which brought in additional funding, but obviously there's terms and conditions aligned with them. So then, in terms of that additional funding of 31 million, it's to cover 6 areas. The big one in there, as I mentioned previously, is a further 11 million to go into adult social care demand. So that was effectively based on the modelling which we've done on Pay Run 10. Some of it is to address the way we fund pay within the council's budget. So again, 8.5 million is earmarked for that. And then the other thing is, I guess, just noting is, whilst the superannuation is going down from 15.8 to 12% for the employer, what it has meant is it's created problems where we charge on into capital schemes and stuff like that. So again, there's a piece of work being done in the council just to mitigate that. And then the other thing is, obviously, you'd have seen that the main finance report and the fact that we're having to use reserves to balance this year's position. Now, obviously, those reserves have to be paid in future years. So simplistically, income, in terms of the comparison with 25-26 budget, income's gone up by over 100 million, of which 41.5 million is around council tax. Then there's pressures of 100.7 million, and across the council, again, there's 58.9 million, as I say, of which there's 20 odd million from the cost council exercise for the proposals, which will be included in the February Exec Board. This next one, I guess the key line in there is the one midway down around pressures demand. You can see in there that we're now modelling 37.5 million in terms of increased demand for next year. We've also addressed some of the pressures around income, not all, but we've certainly reduced the income budget, client income budget next year by £3 million. And whilst it mentions on there 20.13 million for commission service fee uplift, that actual figure is now 17 million, which will be which went to December. So that's that. And then I guess it's just highlighting those risks, which I think are familiar to us all, around demand demography, cost of living, inflation, and I don't think for this scrutiny board, and the other two are really relevant. So then, final slide from me is, as I say, there's 4 key change programmes going on across the council, of which the organisational effectiveness and the prevention programmes will have specific savings detail included in the February exec board report. And all those 2 programmes are on with, but obviously there is a risk around that, so we are looking at ensuring that we have a traditional savings programme running alongside, just to make sure that there is no financial risk on the 26-27 budget. That's whistle stop tour, and I appreciate there's a lot in there, and open it up to members if there's any questions.
Thank you very much for that. Is helpful. I guess the obvious question is in terms of to Caroline, in terms of how the deliverability, in terms of, are you expecting us to be sort of in 12 months' time saying how confident are you in 12 months' time it won't be like over budget again? I note that broadly speaking, it's like the health budget is circa 40 million bigger, which I presume is partly to mitigate that. But then if you look at the pressures for social care commission services and demand pressures, that adds up to over 55 million if you reduce it, like the 30 to the 20 to the 17, which I think Alan just said. So just in terms of managing the budget, is it achievable?
So you'll see in the papers that in the current year there was no growth in the net budget for Adults and Health Directorate, but as Alan has presented, there's going to be quite a significant additional amount of funding put into the Adults and Health base budget for the next financial year. We still have quite challenging savings and efficiencies that we've also got to deliver, but we will start the year with a healthier position, whereby we know that we're going to be, our demand elements are going to be covered. What we've got to do is we've got to continue to make sure that we are meeting our statutory duties under the Care Act. So if people come to us because they need care and support, we have no alternative but to ensure that we're delivering services that meet their needs. We've got to do that as cost effectively and as efficiently as possible, with regard to people's own wishes around how they want their care and support provided. What we are seeing is an upward trend in the numbers of people admitted into residential nursing care. We really want to prioritise how we can reduce that and reverse that trend, which is going upwards. We'd like that to go downwards so that we're supporting more people to remain living independently in their own homes. What that helps with is that, you know, people can contribute to their care and support needs as well, but we recognise that the more people we support in the community, the more pressure that's going to put on income as well. So we're flying against the trend around getting people's financial contributions. So it is an absolute balancing act that we've got to make sure we're supporting people in the right way wherever we can, that we're meeting our statutory duties and responsibilities, that we've got a market that is financially viable, and therefore we're paying providers an appropriate fee for the care and support that they deliver. We're not an outlier in terms of our own market. We don't pay more than, you know, our neighbours or our comparator local authorities. We're constantly check on use of resources data from the Local Government Association to make sure that if there's any areas that we look like we're an outlier, that we will absolutely address and ensure that we're delivering services or commissioning of services as cost effectively as possible. We have very, very robust measures in place. Councillor Arif mentioned a budget review group which meets to look at the savings that we've got and the delivery against those savings so that we're reducing any risk of slippage and non-delivery. I suppose the biggest challenge is flying against demand. And if the demand is there, and if people who have a statutory statutory need for care and support, we've got a statutory duty to meet that care and support. So I want to do my absolute level best to make sure that we're containing our spend within the available budget. And that we're doing it as efficiently as we possibly can. I just know also that we are flying against the trend around demand.
Thank you. I think there's 2 slides for you now. If you go through those quickly, and members, if you've got questions, indicate to me, and I'll bring you in once Caroline has finished this bit.
Thank you very much. So these couple of slides, I'll start and then Jane will come in. These slides are around the savings profiles that we've got for delivery in the next financial year, 26-27. The first of those is around what we call the prevention programme, the adult social care part of the prevention programme. At some stage, it would be really helpful to come back to Scrutiny Board about the work that we're doing around prevention and early intervention and managing demand as well. There's an adult social care prevention programme already that is underway, but we're going to be putting that together with a cross-council prevention programme. And the savings that we need to deliver from an adult social care perspective is £7 million from 26-27, delivery in 26-27, which is already accounted for in our medium-term financial plan. That's why there's a 0 there. It in fact is 7 million, but it's already assumed in the budget setting process. And then following year, there's another 4.1 million in 27-28, and in 28-29, just under another £4 million worth of savings that we are projecting to deliver through our prevention programme. As I say, that work is already underway. We've already started it. We are doing a lot of work around demand management and those people that come to us with our early intervention support. So we will continue to do more of that to help us to deliver that 7 million savings in the next financial year. The next few are smaller amounts of savings, but quite significant detailed amounts of work. There's one around temporary to permanent placements. This is people who are deemed to require a long-term residential or nursing placement from a hospital setting, usually, who are then placed in a temporary placement whilst they are looking for a long-term home, usually family taking time to decide the best placement for them. They can't stay in hospital while the families decide, so we put them in what we call a short-term placement, a temporary placement. And what we want to do is we want to make sure that we capture those individuals, we assess them in terms of their financial contributions, and we seek their contributions from the point at which they are admitted into the placement, so that we're not missing out on achieving some people's contributions over that 6 to 8 week period where they're still searching for a permanent placement. We anticipate that the savings, based on previous trajectories, are in the region of £100,000 for delivery in the next financial year. The next one is working.
Sorry, Caroline. I know these were circulated earlier, so members have had a chance, should have had a chance, hopefully had a chance to read them. So maybe if we just do it a little bit more high level, and then we can ask questions if we need them. Is that okay?
Absolutely. I won't then, in that case, go through all of the ones that are outlined there. It identifies a saving overall of 900,000 on top of the 7 million that we've already got baked into our budget. But as you say, you know, very happy to take questions on any of the specific business cases that we've identified below. If you're happy with it, I will hand over to Jane to talk through the other programmes.
Thank you, Caroline. So from a city development perspective, our net managed budget is circa 41 million, of which 20 million is PFI. So it's difficult to touch and difficult to manoeuvre. So we're working with really small edges. Notwithstanding that, we've brought forward in total about £4 million worth of savings proposals between November and December. Some of those across active Leeds, where we've already implemented the membership pricing, which came forward at the beginning of January once we'd completed all of the leisure centre refurbishment works that took place over winter. Looking at some fees and charges reviews and PFI budget savings, which we think are very achievable. We've really focused on actually things that we think are completely deliverable within the timescales. Some highways savings proposals, moving camera violation and the gritting, which is just a review of grit runs and just efficiencies around how we monitor and manage the delivery of that. And then a couple across asset management and regeneration around commercial property rent reviews and recovery of staff time and fees around the Leeds Transformation Regeneration Programme. And if you've got any specific questions, I'm happy to answer them.
Super, thank you very much. And just to remind members, we in our sort of closed meeting, we talked about the risks around increasing fees to active Leeds. We talked about the risks around how to manage people who refuse to cooperate consent to early intervention. We talked about the extent to which NHS was signed up to working in partnership with us and how that could affect our budgets as well. And we also noted services to adult services, and that being a really key bit. So that's already in there. But any other comments? I'll start with Councillor Lay because you've indicated. Anyone else who wants to indicate, please do so.
Thanks, Chair. Yes, I was going to just mention about the system resilience with working with the NHS. There's a number of assumptions made. What assurances do we have that they will work collectively and also provide the contributions that we have made assumptions about? And then my second and final question, because I'm conscious of the time, is to Alan. Simple question, really. Which of all of the assumptions, either around income or expenses, worries you most, and why?
Thank you. Well, the big one is demand. The demand budget next year for adult social care will be near £400 million. So it doesn't take much of a variance on there. Caroline's mentioned everything around the trend that we're seeing and stuff like that. Within the actual, specifically around the the demand budgets, the one that does worry me is around working age adults and mental health and learning disability. That those packages are very expensive when they do come in, and the trend is, when you look at the 3-year trend, it has gone up quite significantly in each of those cohorts, and it's where does that growth stop? Caroline, is that anything?
If I can answer your question around system resilience, we have really strong working partnership with our NHS colleagues and we're absolutely plugged into the work that the NHS has to do around efficiencies that they're requiring, because they also are experiencing considerable demand pressures, as you will be aware. We have historically been very, very careful that we don't do any cost shunting, so any pressures that the NHS pushes our way or vice versa, we don't work in that way in our health and care system. We've got a really good programme of work, not least the Home First programme, where we've seen massive financial benefits, not just to the NHS but also to Adults and Health, to the council, because of improved ways of working within a multidisciplinary setting, making decisions to support individuals in a very whole person-centred and strengths-based way. So I'm confident. We meet with our NHS partners virtually every day, one way or another. We have integrated commissioning approach, where we jointly have pooled budgets for learning disabilities, for our Better Care Fund, for intermediate care, and I can assure you that we are actually the envy of a lot of systems, because they see the approach that we have in Leeds. I'm confident, even given the changes that are happening in the NHS sort of structure locally, I'm confident that our local arrangements will continue to be robust.
Thank you for that assurance, and thanks for the question, Councillor Lay. Okay, Jonathan, do you want to come in?
Thank you, Chair. In the pre-meeting, we talked about how at Scrutiny we tend to look in a bit of a post hoc way at how the budget's shaped up, and what I suggested might be a useful thing to do in the coming year, given that we're now in a 3-year settlement, is that we have at some point in the work programme a more strategic discussion about the budget and about how the various risks and projections and estimates, etc., are actually come to, so that we can actually scrutinise the assumptions behind it and not just the figures as they come out.
Thank you very much. I'll take that as a comment. Alan, do you want to come in? Yep.
Yeah, just on that point, there was a paper that went in September MTFS update, and we'll be going to the February update, which looks at all future demand modelling, and it also picks up on stuff like what the trend is in terms of what the MTFS strategy is allowing. It also shows what is the trend looks like, if it's 1% over, 1% under, and it also looks at what the timeline trend has been for the last 3 years, and if you extrapolate on that. So we're not there yet, don't get me wrong, but it's something we are really looking to develop that over the next 12 months, 18 months.
And just if I can add, actually in the pack of information that you've got, you can see so many graphs around demand pressures, particularly the impact of increasing numbers of new placements in care homes, in supported living, the impact of, as Alan has suggested, around working age adults and mental health and learning disabilities. So we are very robust in tracking trend. We're perhaps not as good as predicting future demand, and what we try not to do is over egg the pressures, and therefore, it's a really fine balance between getting that accurate relative to what the trend data is telling us.
Super, thank you very much for that question and those extra bits. I can't see anyone else indicating, so what we'll do is we'll go away, I'll go over with Angela and make sure we sort of summarise the points that have been made about the budget in our statement, and as discussed in the pre-meeting, the comments the 5 chairs have made, which will go in there as well. So thank you very much for that. Thanks for the work you've put into the budget. Obviously, a lot of work's been done, and hopefully next year we'll be able to be involved a bit earlier, given the 3-year settlement piece, which is really positive. Okay, so I'm going to close that item and then just move on to the final item, which is the work schedule. We've got 2 more scheduled meetings booked in, plus a working group meeting before the end of the municipal year. That's in your pack. Are there any questions or comments from members on the work schedule? I can't see anyone commenting, so I'll take that as read. So the next meeting, so formal board meeting, is on the 10th of February, starting at 1:30 with a pre-meet at 1, and we've got a working group on home care provision on the 19th, which is on Teams, so see you on that. Thanks everyone for your time. I appreciate your comments and inputs. I think we've had a good meeting, good discussions. Thanks very much. Have a good evening.